My name is Evelyn, and my stomach looks like a butt.
She has the dreaded front butt.
One of our issues between the father of my children and myself was my weight, how my abdominal area looked after the kids.
This is a very common issue that I see in my practice all the time. Moms who have multiple children, and sometimes even just one, and their tummy does not look the same afterwards. And shockingly, there are men out there who just are not understanding of when this happens. Having babies changes a woman's body, and guys, you gotta just deal with it. It is normal.
I didn't have very much money, so I decided to go over the border to Tijuana and do my surgery.
That is not a good idea. Now, plastic surgery is admittedly very expensive. Insurances don't typically cover tummy tuck operations. So because it's so expensive, people do travel overseas and to other countries to have plastic surgery. If you do this, it's so important for you to make sure that the doctor performing your operation is ethical, is well-trained, and that there are facilities available if you have a complication. Make sure you have all of this covered at minimum before considering going to another country for plastic surgery.
After the surgery, I started noticing a lot of redness around the area. The incision came apart. There was a lot of discharge, a lot of pus, and it became a wound.
It sounds like she developed a severe infection after the surgery, but in addition to that, it also sounds like she had some major healing problems too. Sometimes infections can combine with tissue necrosis, meaning dead skin or dead tissue, causing a wound that can take months to heal. And cosmetically, that can be very, very devastating.
I could fit maybe a baseball in my abdominal area.
When you have tissue necrosis, part of the skin and the fat underneath it can literally turn black and it can die, in which case you have to cut that dead tissue out, and that can leave a huge hole. The two times that I've seen this in my practice when it happened to my patients is when they've smoked after a tummy tuck. This can also happen due to secondhand smoke and potentially due to a massive infection.
So now my stomach looks like a butt.
So why does it look like this? Well, I would assume that she has a scar coming down the middle of her lower tummy, just below her belly button, and then she probably also has a horizontal scar underneath from the tummy tuck where it hangs over. And you combine the two, and it looks like a butt. Now, I have treated patients with front butt before. Take a peek at this before and after, and you can see that it can be treated very effectively.
I went to a party in 2009, and that's where I met my husband. It took a while for us to be intimate together because I was very shy to show him my body.
This is more common than you may think. I have so many patients who come in to see me for plastic surgery, both men and women, and it's not uncommon that they won't allow their partner to see them naked. I have had some patients tell me that their spouse hasn't seen their body naked in over 20 years.
He ran into complications and he wasn't able to finish it. I kept trying to move his hands away from the area.
You woke up during surgery?
Yes.
So he stopped the surgery in the middle of the surgery?
Yeah.
Oh wow, this actually gets worse. So this doctor was trying to perform a tummy tuck under a local anesthetic, meaning that you have to actually numb all of these areas up, and she is partially awake for this operation. That is insane. I perform all of my tummy tucks under a general anesthesia. I've heard of some doctors performing it with a deep sedation with certain nerve blocks, but not awake like she is here. That is just crazy. This episode is brought to you by my skincare line, Youn Beauty. Our products combine natural and organic ingredients with the latest in scientifically proven anti-aging components like vitamin C and retinol. So if you're looking for healthy and youthful skin without the unnecessary chemicals, this is the skincare line for you. Check them out at dryounonline.com and use the coupon code 20OFF to get $20 off your first order over $99. We'll put a link in the caption below. All right, back to the video.
Fixing this problem is not that straightforward because you need this scar removed, but you're kind of tight.
The way I would normally treat something like this would be to perform the tummy tuck over again. So essentially you want to make a cut into the lower tummy, lift the skin up off of the muscle layer, and then pull that skin back down, cutting off as much excess as you can. The problem is if you've had a tummy tuck before, now you've got scar tissue that's there, and if there's not enough loose skin left over, then you've got a problem because you won't be able to flatten the tummy out as much as you may want to.
If you decide to undertake this operation, there's a risk of course, bleeding and of this happening again. And are you willing to go through that possibility?
I think I am.
There are times in your life as a doctor, and for me as a plastic surgeon, where I know the odds are stacked against me, but I have to perform an operation for a patient because I know that the consequences of not doing it are probably worse than the consequences of proceeding. So in these situations, sometimes you just have this idea and this notion and this confidence that maybe from up high that this is the right thing to do.
To restore Evelyn's abdominal and pubic area, I will first do liposuction on her sides and the central portion of her belly. I will then make an incision across her scarred abdomen and tighten the muscles below, which will give her skin laxity, and then remove the damaged tissue.
So this is interesting. He's taking a different approach than I probably would here, in that he's starting with the liposuction and then he's removing a small amount of tissue below. What I would probably do in this situation would be actually to perform the actual tummy tuck again and then liposuction her sides, possibly coming back later on to finish liposuctioning the actual tummy. There is a risk that with liposuctioning her tummy and then pulling the skin down with a tummy tuck, that she won't have enough blood supply to heal the tummy, and the whole thing can happen potentially again. That is the last thing that I would want to happen to her.
So they did tie up the abdominal muscles all the way up to the breastbone in Mexico. They went so far up they may have devascularized, impaired so much blood flow to the flap down here that's why it fell apart.
When we lift the skin up off of the muscle layer during a tummy tuck, we only want to lift it up just the bare minimum of what we need to pull it down to get rid of the extra skin. If we cut more than we need to, we are then cutting through blood vessels and blood supply that can be necessary to heal it. And it sounds like that may be what happened with her surgery in Mexico.
So we elevated up the skin, we sewed down the abdominal muscles, removed the entire abdominal wall deformity and all the scar, and made a new belly button.
Okay, now it sounds like he did what I said that I would do here, essentially redoing the tummy tuck over, and if you need to come back and lipo the tummy itself later, you do that then. Let's see how she turned out.
My scar held me back a lot in my life. I didn't feel like sexy enough for my husband to see me completely nude, and now I can finally be me. Before my surgery, I had 2 butts. After my surgery, I only have 1 butt.
Props to Dr. Dubrow for such a nice result. Well, there are so many episodes of Botched with crazy outcomes that I've reacted to on this playlist right up here. So take a peek at that. If you've been enjoying my videos, please subscribe to my channel, and always remember, eat real food, use clean skincare, and only consider actual plastic surgery as a last resort.